Fall is here with pumpkins and cooler temperatures, but it also brings respiratory illnesses like colds, RSV, COVID, and those pesky allergies. How do you know what you have and what you should do to actually feel better? Nurse practitioner Jolene Kennedy was with Cone Health Chrisman Family Practice. She's here to answer those questions and is here to help you stay healthy and fit. It looks like we're having a little bit of difficulty here, so I'm going to change this camera back to the right thing here. There we go. Now we've got you up here. How would someone know if their symptoms are from the common cold or the RSV or COVID?
So that gets a little bit tricky. So for all of them, symptoms tend to come on gradually, so slowly. With COVID and RSV, you may see a fever of 100 or greater, but this isn't usually present with a common cold. So you may get a low-grade fever of 99, like 100 or less than 100, but you're not going to get those above 100 fevers. All of them can present with a runny or stuffy nose, sore throat, headache, body aches, cough, and fatigue. With RSV, you may see a high-pitched whistle sound that we call wheezing, and that can present with breathing. And this isn't usually present with a common cold or COVID, unless a person has some underlying lung disease. And then with COVID, you may see nausea, diarrhea, vomiting, loss of taste or smell, and this often distinguishes it from RSV and a common cold. Some of the recent variants we've seen, like a razor-sharp sore throat, and really to get the full diagnosis, testing is a good idea.
So it's no longer that if you lost your taste buds, you have COVID.
Not always, no, not always. Not everybody has that.
Okay, what about those fall allergies? How do you know if that's the issue?
So fall allergies and viral illnesses can have similar symptoms. However, there are some features that distinguish them between each other. So with fall allergies, you can have those itchy, watery eyes, a scratchy throat. There's not going to be a fever, sneezing, and that runny nose. So you're not going to get that fever, body aches, or that really bad increase in fatigue that you might get with a common cold, RSV, COVID. And also allergies present if there's exposure to a trigger and they last a while. So you're thinking about pollen allergies, whereas viral illnesses often resolve in 1 to 2 weeks. So if something's going on longer than 1 to 2 weeks, you often can look more towards allergies.
Okay, so you talked about 1 to 2 weeks as allergies, but what's the time frame really for like the flu? How fast can that impact us?
So viral illnesses really are often more than 1 to 2 weeks. The allergies are usually going to last a little bit longer. So your flu, COVID, those are the ones that are usually going to be limited to 1 to 2 weeks.
If we have that, what do we do to manage the symptoms at home?
So common cold, usually, symptoms are often mild, they're self-limited. So you really want to focus on rest, increasing your fluid, and use of over-the-counter cold medications, which are safe for your age group and don't interact with your other medications that you're taking. And you may want to talk to the pharmacist in regard to what would be safe to use. I'm an adult geriatric nurse practitioner, so I'm big on teaching my patients. If you're diabetic or have high blood pressure, just making sure you're taking medicines that aren't going to increase your blood sugar or increase your blood pressure. And that's when you can ask your pharmacist. They're a valuable resource. COVID, you want to kind of ensure that you're isolating and distancing while symptoms are present. And there's no real specific guidelines on that, but I do tell my patients, while they're symptomatic, try to isolate from other people. And again, you can use over-the-counter cough suppressants, fever reducers, monitor your symptoms carefully, and then seek medical attention if you start to have breathing difficulties, such as shortness of breath. There are also treatments that we can use for COVID. One of them is called Paxlovid, but you have to start it within 5 days of symptoms, and you'll need a prescription for it.
Okay.
RSV, similar to common cold, just regular treatment over the counter. And again, if worsening symptoms, you go to get seen. And then allergies, just over the counter, antihistamines, nasal sprays. If you're over 65, try to avoid Benadryl.
So you told us when to go get seen, but do you always have to go in, or could you do like a virtual visit? Does that help too?
Yes, so definitely, if you want to be treated, say that you're concerned that you have flu or COVID, you're going to want to get testing. And so in that scenario, a virtual visit may not be beneficial. You may want to go into the urgent care setting or into your primary care office. if you're just more concerned about a common cold, or if you're not interested in pursuing some of the treatments for COVID or flu, then a virtual visit's a great option, especially if you have mild symptoms. If you have more moderate symptoms, then you may want to consider going to urgent care setting and getting seen. Or if you're higher risk, you may want that face-to-face visit. So if you're more having chest pain, shortness of breath, or if you've got a really high fever, that's when you may want to seek care more in that emergent setting.
The state actually just saw its first flu death of the year last week out in western North Carolina. What kind of flu year are you expecting?
That's always a tricky question. I expect to see a little bit more flu this year, depending, of course, on how many people get vaccinated and how people are protecting themselves during the season.
Vaccinations, that's the key for flu, COVID, and RSV. Who should be considering those?
So the COVID vaccine, that one's getting tricky. So right now they strongly advise it for adults 65 years and older. It is recommended for those 19 to age 64, but they say to discuss it with your provider first, especially if you're immunocompromised or if you have a chronic health issue. And then children 6 months and older, they say to discuss those vaccinations with a healthcare provider, and we do have those available at Cone Health. Flu vaccine is recommended annually for everyone 6 months and older, especially older adults, pregnant women, younger children, and people with certain health conditions, just to keep them safe during the season. And then RSV, that is a single dose. So the CDC recommends it for pregnant women during weeks 32 through 36 of pregnancy to protect their baby from severe RSV disease. And then adults ages 75 and older and adults ages 50 to 74, increased risk of severe RSV.
Can you just go and knock all these out at one time, or is it best to space them out?
So I will be honest, I did get my COVID and flu at the same time. You can do it. You might feel pretty bad. So I do tell my patients, sometimes it's good to separate them just so you don't have some of the side effects joined together.
Okay, besides the vaccines, are there any steps we can take to lower our risk of getting sick?
So trying to avoid exposure is a big one. So if you know somebody in your family is sick, trying to limit your time around them. And then just being cautious when you're out and about. So washing your hands is a really important way of prevention. And then just covering your mouth, covering your nose if you're sneezing, coughing. Those are big ways to help prevent illness.
What are you predicting this fall is going to be some of the big challenges people might have when it comes to respiratory illnesses?
So things that I've seen patients so far this year, I noticed that they have worsening cough symptoms recently. And then, of course, vaccinations, I do see that kind of 50-50 in regards to who's getting vaccinated. So I think there'll be a little bit more of a higher flu season. Definitely some COVID is presenting again. So it's kind of just waiting and seeing which directions we're going.
Speaking of coughs, we've all had that one cough that just lingers and won't go away. When do you need to see someone about it?
So there's a really good access to conehealth.com/getcarenow. It's a great website to look at, and it even explains, different places you can go. So I think of it as mild, moderate, and severe. So virtual care I think of as mild symptoms. So those are those non-emergent symptoms such as the cough, runny nose, sore throat. If you don't want to leave your house, it's a great option. I've actually used it. It worked wonderfully. Urgent care is a great place to go if you're having more moderate symptoms. So if you're having a fever, wheezing when you're breathing, or if you want to be tested for flu or COVID, urgent care is a great place to go. And you can even schedule urgent care visits online, which I have done personally and works wonderfully. And then emergency care, I always save that for my severe symptoms. So I tell my patients that's where you go if you're having chest pain, severe shortness of breath. That's when you want to go seek immediate care.
Why is it so important to take these symptoms seriously and not just brush it off?
Well, because as we've seen, we had our first flu death this year. So, I always think to myself, flu and COVID, they seem like a simple viral illness, but simple viral illnesses can turn into major health issues if we don't keep an eye on ourselves.
Anything else you want people to know about staying healthy?
So my big things are always getting vaccinated. I'm a huge advocate for vaccinating. It's a great way of prevention, and just remembering that the vaccines are so easily accessible at many locations, including pharmacies, Cone Health, lots of different locations. Washing your hands, really, really important. So at least washing your hands for 20 seconds with good soap and water. If you sing happy birthday twice, you will get through a good hand washing. And then one thing I always think about is my mother always told me as a child to cover my mouth and nose if I'm coughing or sneezing. And so that really is a good way to prevent you from spreading to other patients or other people. And then just making sure you're getting lots of good water in daily, good sleep, and then getting a good nutritious meal. Those are things that help support your immune system.
A good mom there teaching us all the right way to do it. Thank you so much for being here. We really appreciate it. All of this
You're
information
welcome.
and more will be up on WFMYnews2.com and the 2 Wants to Know section later if you want to share it with the people you love to keep them healthy as well.